Hi, this is Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything's magnified a bunch on the screen. And right now hold the camera please, we're about to put in our shaver. So we can use this not only to irrigate the joint, but to start to have a look around here. One of the first things we usually look for is the biceps tendon. This is it here. The biceps anchor is a little bit frayed, but given everything else that's been going on in the shoulder, not too bad. So we're just irrigating right now. We're going to look, hold the shaver please. We're going to look towards the bottom of the shoulder. This is the back, posterior aspect, inferior. There's the joint capsule. You can see some arthritic change on the glenoid down below, but really not too bad. Lift straight up on the arm. A little bit of fraying in the labrum down here, but again, not too bad. Now we're getting to the anterior portion of the shoulder. And other than some redness in the tissues, some inflammation in the soft tissues, I don't see any significant labral detachment. Hold the shaver, please. And now we're going to look up at this rotator cuff tear. Remember, this is a revision, so we'll see probably some old suture material. All in all, doesn't look too bad here. We'll keep working here and show you some more in a minute. Okay, so we're bringing the spinal needle right through the portion of this tendon that we know is essentially completely torn from our imaging. We're going to hold the camera, and then we're going to pass a purple suture. It's called a PDS. We just use this as a marker stitch. We'll just pass this down. I'll show you as it comes through the tip of the needle, then we'll go off on the video. Next step, there it is. We're going to change positions. Two hands. We're going to change positions with your shoulder in just a minute here. Pause. You have to hold it for like 3 seconds. Okay, it's Dr. Buford here. We're up in the subacromial space, which is the area above the rotator cuff. Now we're outside the joint. Your clavicle's over here. Push on his right behind that little bone spur that we're going to remove in a minute. You've had a lot of scar tissue in here. We've actually spent about 15-20 minutes just removing scar tissue, and honestly, that may be the biggest thing that was blocking your motion and causing symptoms, because you had a tremendous inflammatory synovitis that we can finally just now see the subacromial space. But at the beginning of this part of the surgery, we couldn't see anything. Literally, this whole space was full, and now it's open. So there's some old suture material over here that we can see. That's way medial. That part looks okay. Our marker stitch is way over here. And as you can tell, we don't see a huge tear in the tendon yet. I'm a little suspicious about some of this stuff right here based on this imaging that we did. But the next step for us is to go ahead and pull that marker stitch now that we see it. And then we'll continue. See all this scar tissue? See how these adhesions stretch from the cuff and the bursa up into the lateral bursal shelf, and they can really restrict motion. And so we're just trying to free all this up so it looks a bit more normal. That already, believe me, that already looks 100% better. We're going to keep working here, show you some more in a little bit. Okay, so we've done an AC joint resection. This is the end of the clavicle here. This is the acromion on the right. Clavicle to the left of the probe, acromion on the right. We've got plenty of space here. We can look all the way up, and we can see that that AC joint is clear now. Here's the acromion side. Okay, so you can see some old suture material here from the prior surgery years ago. But now we know that AC joint shouldn't bother you anymore. And we're going to continue on and look at the rest of the shoulder. Okay, so we've taken out a few of the old sutures. And again, that's the clavicle over there, so we know that that's medial, anteromedial. This is anterolateral. And I really think the most remarkable thing that we've seen has been a tremendous amount of scar tissue and really just really thick inflammatory stuff. It's continued all the way down through this lateral gutter. We've just been spending a lot of time resecting it, trying to free up the shoulder. And having done that, now we look, and I don't see a huge defect in the tendon. It wasn't normal, but again, you've had a huge surgery, and I don't know that that would be better if I redo a huge surgery for you right now. I think the smart thing to do might be to wait and see how you do with this extensive resection of all this scar tissue. You can see I'm getting all the way down around the lateral side here. All in an attempt to free up all this scar tissue. So my plan would be to actually start you moving right away, because we don't want this to form back up. And then as we look here, we can see that there's really no significant defects. Hold the camera here. Two hands on it right about here. We're going to rotate the shoulder. So this is the posterior aspect of the cuff here. And then as we come back and rotate again, hold right here. This will be the anterior aspect of the cuff up here. And we can see that it's rotating without any defects that I can appreciate. And now we're all the way back into the muscle posterior, so we know we've gone back as far posterior as we need to go. So I think we're going to finish up here and get you into some good solid rehab, maybe do a PRP shot in the office to minimize any scar tissue and inflammation, and get you back to the recovery room here in just a few minutes. So I really hope this does the trick for you. We certainly haven't burned any bridges, but I don't see a reason to take down what you have here. So good luck to you now, okay? Bye-bye.